passing blood in the urine is a big red flag and needs to be investigated. I am Dr. Subramanyam, consultant urologist and transplant surgeon from Apollo Hospitals Jubilee Hill, Hyderabad. We do see a lot of patients who come to us saying that they have passed some few drops of blood in the urine. Now, majority of these patients go to a general physician and they would probably end up taking a couple of antibiotics, and naturally the blood in the urine will stop. But the problem is that blood in urine needs to be investigated thoroughly to find out if there is any particular reason for why the patient has got blood in the urine. Blood in the urine could be either macroscopic, that is which you can see with the eye, so a patient passes reddish urine, or could be microscopic. Sometimes there is so much small amount of blood that it is not visible to the naked eye, but you do a urine sample and you would see a lot of red blood cells in the urine. But blood in the urine, whatever it is a big red flag and needs to be investigated. And it is very rare for infection to produce blood in the urine as a standalone symptom. Majority of the patients with infection, if they get blood in the urine, would probably get blood when they have a severe infection. So they would get a lot of other symptoms before they start producing blood in the urine. And the important thing to realize is whatever condition produces blood in the urine, it is not that this blood happens all the time. The blood automatically stops after a few days, and most of the patients would probably go into a false sense of security, thinking that okay, the blood has happened, I have taken some antibiotic and it has stopped. It is not that. Infections do not produce blood in the urine. Is not a very common problem with infections in the urine. Now, what can produce blood in the urine? There are a lot of things which can produce blood in the urine, particularly in people who are slightly elderly, in the late 40s, 50s. One of the commonest reasons for blood in the urine is a tumor in the bladder or a bladder cancer. So when somebody passes blood in the urine, particularly if it is painless, that is, you go and pass urine, your urine is reddish without any pain, no discomfort, we definitely need to investigate these patients to find out if there is any tumor anywhere in the bladder, in the tubes coming from the kidney, or in the kidney itself. And these patients require a thorough workup. You would also see sometimes blood in the urine in some nephrological conditions, something called IgA nephropathy and things like that, which are diagnosed with a kidney biopsy. So the presence of blood in the urine or somebody passing blood in the urine is not something which should be taken lightly and should be thoroughly investigated. Now, what do we do with these people? When the patient comes to us, we would definitely do a good clinical examination to find out if he's got a lump in the abdomen, if he's got a bladder problem which can be clinically felt, if he's got any redness at the tip of the urine pipe which can also produce blood in the urine. But majority of the workup relies on investigations. The first investigation we would do is probably an ultrasound scan, which would go a long way to find out any major problems either in the kidney or the bladder. Sometimes you could have a small stone in the kidney which can produce blood in the urine. You can have a kidney tumor, you can have a tumor in the bladder. Bladder tumors again are very common in industrialized countries compared to India, but we do see nowadays more and more bladder tumors because of rapid westernization of the Indian society. We also see a lot of bladder cancers because of smoking. And one of the many cancers which are produced by smoking, which itself is a very big health hazard, one of the many cancers which are produced by smoking is bladder cancer. So all these patients would definitely get at least an ultrasound scan to look for many major problems which can be responsible for producing blood in the urine. Now, if any doubt exists because on the ultrasound scan, these patients would definitely go and get a CT scan, which is a much higher resolution imaging compared to an ultrasound scan. And CT scan would tell us not only the function of the kidney, the size of the kidneys, and also if there is any problem in the ureter, which is the tube connecting the kidney to the bladder, as well as the bladder itself. Now, if all these investigations are normal, these patients definitely would warrant a cystoscopy. A cystoscopy is a test where we put a scope through the urine passage into the bladder to look inside the bladder to see if the patient has got any growths, any tumors, any inflammation, any stones in the bladder. Sometimes if the patient has got a small bladder tumor, this could be missed with the best of the scans we have got. We missed with an ultrasound, missed with a CT scan, but could be picked up by a cystoscopy. We also do some special urine tests on these patients which are called urine cytology to look for any abnormal cells in the urine. And if all these are negative, We will also do what is called a phase contrast microscopy for urine to find out what we call a deformed RBC. If the RBC, red blood cells which we see are normal, it usually indicates that it is bleeding from the surface of the kidney. If it is dysmorphic RBC where the shape is abnormal, then obviously it indicates it's bleeding from the filters which are there in the kidney. So blood in the urine is not a thing which to be ignored. Blood in the urine definitely not to be treated with an antibiotic, but should be thoroughly investigated, particularly in an age group of between 40 to 60, where most of the tumours or malignancies or cancerous lesions in the urinary tract can produce blood in the urine.